Please welcome Leah Binder.
Thank you, Cheryl. And again, it is just such an honor and a pleasure to be here in Wisconsin with all of you in a place that truly has such meaning to Leapfrog. As I said, Madison is in many respects the birthplace or part of the birthplace anyway, of the Leapfrog Group. So today, I'm going to talk with you about this theme of today, aiming for impact. First, I'm going to give you a landscape, very, very quick overview of the political landscape that we're in right now as it applies to healthcare, and the impact of movements around value and transparency that have come out of this politics. And then I'm going to show you what the role of the Leapfrog movement is in that. The Leapfrog movement is one that you are a major and leading part of. And then I want to show you a few tips, humble tips, on navigating the complexities of these changes that we're seeing in healthcare. So first, the political landscape. Well, there's bipartisan agreement on healthcare, as we all know. Right? Well, believe it or not, there is something both sides agree on. And it's this. They agree that transparency is critical. I cannot tell you how many times we get calls at Leapfrog to come up and visit with some staffers or some Congress members on the Hill to talk to them about transparency. What do we need? We need more transparency in healthcare, more information, more pricing information, more quality. What are you not getting from CMS that you want? And this request comes from both sides of the aisle equally. Everybody wants to figure out how we open up the healthcare world. That is the absolute one thing that both parties agree on. Now, the details of what they're going to want to do with that is not necessarily going to lend itself to bipartisan compromise, but the principle of it is. And that is actually shocking considering the gridlock that we've seen, particularly around healthcare. So, let's talk about where that probably comes from. So you get a quiz. I bet you didn't know that, but I'm going to make sure you're all still awake, although after the last two speakers, I'm sure you are. They were fabulous. Which of these groups spent the most money on U.S. healthcare in the year 2014? So this is from CMS Actuaries. They actually do a study of spending in healthcare in the U.S. every year. It's great bedtime reading. It will put you right to sleep, but I actually do read it. These are the things we do in Washington. And they divide into these spending categories, and they assume everyone just knows that that's the spending category. So here they are. The first spending category is Medicare and military VA. So the whole bucket of federal spending, federal taxpayer dollar spending. That's A. B is Medicaid. C is private business, so employers, purchasers, like so many of you in this room. Health plans is D. Or is it something else, E? Well, in fact, it is something else. So federal spend is second at 26%, that yellow piece of the pie. 26% of a $3 trillion healthcare system is spent by us as federal taxpayers. The other piece that's pretty large is private business, 21%, but it's not quite as large as the others. And then Medicaid is, I think, 18%. Health plan's very small slice, because as most employers know, you think Aetna is paying that bill when you give them a card that says Aetna at the emergency room, but actually it's the employer behind Aetna. So they're really passing through a lot of dollars. So they are actually not a big player among spenders. So what's that other? Consumers. Consumers spend 28% of the money in the $3 trillion health system. This is their spending through their own portion of the premiums they pay in healthcare and their out-of-pocket costs. That combination is now 28% of all spending in the U.S. And yet, so many hospitals that I know, if CMS changes a line on a regulation, a word, on page 496 of some tome, They're all over it. They got 20 lobbyists right on it. They want to know everything that's happening with CMS, every dime CMS is spending, because it's so influential. They're a big spender, but they're not as big as this one. And most hospital executives that I've talked to do not know the statistic I just gave you, unless they saw me speak before. They don't know it. They don't even know that consumers have such a chunk of the market. And there's no other industry where 28% of your market, you don't even know is 28% of your market, where 28% of your market is virtually irrelevant to your considerations financially until now. And that's why the Hill is suddenly so interested, because things have changed. We now have high deductible health plans in many parts of the country. 1 in 5 American workers at least is covered by one. They pay virtually every dime of their health costs underneath a pretty high deductible. That has changed them. They are suddenly shopping. And we live in a world where consumers have changed. All of us have changed as consumers. I now shop online all the time. And in fact, I expect to read reviews of things that I buy. I expect the sort of dynamic that I get online everywhere. That's what I expect. And many Americans, of course, are raised in that generation. They don't know what that cord thing is that comes off a telephone. Why do you have that? They don't know. They are raised on a generation that has changed fundamentally in how they think about their role as consumers. So you have this change happening in the wider world, in other industries, and you have this fundamental shift in the economics of healthcare and the enormous potential impact of consumers as an economic force in healthcare, one that we have only begun to see. So that's a very general statement about a political landscape, but it's a key political landscape. And one other thing to add to this political landscape is, I mentioned that private sector employers are 21% of that pie. So you combine them with consumers, and you have almost half of all the spending in the US. And in many respects, purchasers, like so many of you in the room, are working with consumers, we do on the national level, to advocate for changes and shifts and better value and better improvements. So the power of this movement toward better care at a better price has become very dramatic. And we've got to lend more momentum to that, because we have opportunity like we've never had before in history. So what is the impact that we're seeing of this shift toward transparency and demanding more value in consumerism? Well, first, it's a movement for price transparency. Now, I have been in health policy for a few years, maybe 20, and I never heard of the term price transparency until about 3 years ago, maybe. It's a relatively new concept. In fact, I never heard of costs in healthcare being described as prices before. That's a fairly odd new way of describing it. It really is what it is, right? It's what somebody pays for care, not reimbursement, which is a very different idea. Reimbursement is what's owed to me. Price is what I'm asking you to pay me, but I might not get. You don't reimburse Walmart for the toaster you bought, right? You pay them a price. It's a different way of thinking entirely. And the whole price transparency movement is a very powerful one. This is an example of one organization, the Castlight, which does a lot of work in price transparency and is working with employers to provide their employees with more information on pricing, which they want because they're in these high deductible plans. But there's zillions of others, and most health plans are now moving toward models of price transparency. It's still in its infancy. We are not there yet, but this is a very powerful change that we're seeing in the market. It's certainly an impact that we've seen from the politics of healthcare right now. And of course, in quality, we see a burgeoning movement of public reporting on the quality, particularly of hospitals. I think over time we will see that more of particular physicians. We did see some public reporting around surgeon quality last year. We'll see more of that, but it's even more sophisticated in the area of hospital quality, and there are a zillion ways now, organizations that are putting this information out. and more aggressive in the market about getting their message heard and making a lot of money. This is just a sampling of them, but there are some like Amino that just started out that's a very powerful new rating tool. And organizations like Yelp are putting out reviews of providers. So we're seeing this burgeoning movement of public reporting on quality. And of course, Leapfrog is part of that. You'll see a hospital safety score prominently in that my composite slide, and certainly the Leapfrog ratings as well as part of that. So what has happened as well as an impact of this growth of consumer involvement and consumer exertion of consumer influence in the market has been a similar and parallel move by payers to act more as consumers would in the market. So we call this movement value, but in a sense what it means is let's act like rational consumers. Instead of just paying for every service, the fee-for-service model, pay for every service no matter whether I need it or whether it's good or whether it's even useful or relevant, instead of paying for all that blindly, I'm going to actually pay for the right care, the care I want and need, and I'm going to shop around for prices and get the right price. I mean, that's, at a very simplistic level, what we as consumers hope to do. We don't all do it well, but we try. And now payers are starting to do that. And the premier payer that's starting to do that is that 26% of the market, CMS. And through the Affordable Care Act and other initiatives, CMS has really put some stake in the ground around value-based payment. They've done some work changing the way hospitals are paid under Medicare, tied to their rate of readmissions, tied to their rate of hospital-acquired conditions. They've also tried some new models for paying, like bundled payments, which actually was pioneered by Geisinger, which is an idea that I'll pay you one payment for everything that's needed to deliver this one outcome, so particularly a surgical outcome. And that then creates the right incentives, because the incentive is with the provider to do it well, so they're not wasting money, and it's to get the right outcome, and because that's where the payment is tied, not at the service level. So they've been trying some very innovative things. ACOs are another outgrowth of that. And the private sector's also, in parallel, trying to tie more of their payment toward value. And the study that I think is very interesting is Catalyst for Payment Reform, which is a nonprofit organization. It's based in California. It's actually run by my predecessor at Leapfrog, Suzanne Del Banco. They did a study 3 years ago to ask how many payments are actually tied to value. They're being done for commercially insured populations. And they found it was, when they first did it, 11%, which was not impressive to them. 11% after all the years of trying to get some kind of outcome-based payment was a little bit disappointing, to say the least. But then they did it a year and a half later, the same study, and they found it was 40%. So the growth in this value model has certainly been there. Now, there's lots of ways that it's not quite as exciting and dramatic as 11 to 40%, because some of the value-based payment arguably is not particularly rigorous, as it doesn't really meet the requirements of what we would all think of as value. But nonetheless, the effort's there, it's happening, and it's really driven in part by CMS's acceleration of this movement. The movement toward value is very powerful. And healthcare is completely and totally unprepared for this, totally. Here's just a screenshot from a study in JAMA that kind of looked at what's going on around price transparency and found that there were ranges in pricing from $11,000 to $129,000 for the same procedure, and no physicians themselves couldn't figure out what this was. There's also some literature here about how even when we could figure out how much the price is, we didn't know how to talk to patients about it. They are completely unprepared to talk about pricing or to even find the right pricing data. That is still something that healthcare is struggling with mightily. And they're confused by the whole movement as well. Here's an article in Health Affairs. National hospital rating systems share few common scores and may generate confusion instead of clarity. Now, this was actually a nice piece that really the headline mischaracterizes. The piece really talked about what are the differences in 4 different rating systems, one of which was the hospital safety score. How are they different? Well, they're looking at different aspects of hospital performance, very different aspects. And their goals are different. One of them, for example, wants to find the 10 best hospitals for a particular procedure. On the other, like hospital safety score, we're the only ones that look only at safety, only at the bad things you do not want to have happen at a hospital. So the errors and the accident inspections. So that's what we look at. It's different. It's just very different perspectives. It's not confusing. And so all of the ratings organizations, we work with them all the time, and we do our own market research, they do theirs. And they don't find consumers are confused by the idea that there's a lot of different perspectives on hospitals. Hospitals are complicated places. And we're not confused by the fact that there's lots of different perspectives on a movie or a car. In fact, we like that. Most of us want more reviews, want more opportunities to get perspectives on something we're considering buying, particularly if the thing is important, which certainly hospital care is very important. So I think there's just a deer in the headlights reaction from a lot of providers about this environment of ratings, but it is not going away. So it's time to get serious about understanding it and understanding how you can best play in that market. So to the tune, though, of providers unprepared, this is where providers are, in a classic way, on transparency. So this is a screenshot from Hospital Compare, which is the CMS website that does what its name suggests. They allow consumers, theoretically, to compare among hospitals and make decisions. So they allow you to compare 3 hospitals at a time. Here's 3 in Connecticut. And this was 2 weeks ago. The first measure is ischemic stroke, blah, 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 right? That's how it looks to me. Oh, new glasses. Is there anyone reading this who would pick a hospital based on that first measure? Ischemic stroke, timing, blah, blah, blah. Anyone here would say, no, I don't like how they did on that, so I'm not going there. Anyone? Okay. Well, let's say you thought, yeah, that matters a lot to me. The bad news is that all the hospitals are perfect on it anyway, pretty much perfect. Maybe one here's 93%, that's probably a low ball. But almost all of them are going to be like these, 100%. So they're perfect. So how is that particularly useful? You don't even care as a consumer much about the measure, but even if you did, everyone's perfect on it. So now I recognize that providers care about that measure and recognize what's important, and I don't want to dismiss that. It's certainly useful to them. So there's a reason to do it, but the reason is not transparency to consumers. But there are some measures, thanks to the efforts of people like you in this room and the influence of the Alliance, the influence of people like Barb Rudolph, people like Leapfrog and our movement nationally, that really, really pushed on CMS to publicly report data that does matter to consumers. And you see the evidence of that here. Here's some death rate from stroke. That does matter to consumers. You might want more data than just one measure here, but you will notice that. That matters. But here we go with some bad news again. In my 3 hospitals, look at that. They're all no different than the national rate, meaning they're all average. And as it turns out, for every one of these measures, over 90% of the hospitals are going to be shown as no different from the national rate. Over 90%. And the others, 5% will be shown as below the national average and 5% above. I would strongly advise you not to go to the ones below average because it takes a lot to get there on this. So really this isn't giving you any any kind of information you as a consumer could use to differentiate among hospitals. And so what hospitals are beginning to recognize is that, and oh, by the way, that is also common in state reporting. So I've heard a lot of providers will say, well, we also report at the state level and we're doing lots of good things there. And they are, but this is a very common way that the data providers report is displayed, especially when there's a lot of politics underneath it. And everybody's average, and we don't show you things that really matter all that much. So that's changed. That's what this new political movement is changing. That won't be enough anymore. It isn't enough anymore. And that's why you're seeing this growth in this whole industry of public reporting. Because people who are shopping online, like all of us shop online, you want unbiased information. Well, that's not unbiased because everyone knows hospitals are not all the same and they're not all perfect. And that's kind of what it's saying, right? And we know that's not the case, so there is some politics to how it comes out that way. And we want to see variation, especially when you're making a decision. And by the way, in healthcare, there is variation, lots of it, and you should be aware of it. And finally, they want information that's relevant to them. So automakers do not give you a guide to cars that tells you the quality of the plastic that was used in the production of the dashboard, because you don't care. Now, maybe an automaker cares and thinks that's an interesting thing to look at, but consumers don't care. We want to know, what do we want to know? Miles per gallon. Does the thing look good? We have our specific relevant measures, and we want them. And so that's what we expect. That's what transparency really means. And it's a very significant shift from what healthcare is used to, even in its first forays into transparency, which were the CMS Hospital Compare. So we have this political movement. Transparency's first on the agenda. There has been and will be increasingly an impact that will be the burgeoning of price and quality transparency, which is full speed ahead and increasingly demanded by consumers. And healthcare needs to get prepared for that very, very quickly. Time is short. And so that's where we get to the key role of the Leapfrog movement. Now here's a screenshot of just a quick screenshot of some comparisons on the Leapfrog website of hospitals that report to Leapfrog. And you can see that there's variation. So 4 bars means top performance under that standard, or meeting our standard, top performance. And 1 bar is willing to report, which is relevant. They're willing to be transparent, but it's not the highest, by no means the highest performance. So what you can see from just a quick screenshot is that we show the variation, lots of variation. And we're not biased. In fact, our board is deliberately not including anyone from industry. So we have no hospitals, no pharma, no health plans, nobody who does business in the industry. We are deliberately independent in our governance. Now, we work with industry all the time. So we're collaborative in the sense that we are looking for advice, guidance, and input, and use it all the time. But our governance is absolutely independent. We're very clear and focused about that. Because we want to draw the cut points. We want to draw the lines when we have to on what constitutes good, better, and best performance. And finally, it's relevant to me. Every Leapfrog is designed by, for, and about purchasers who want something their employees can use. So it is designed to be relevant. We pick measures that are not available anywhere else and that are relevant and important to consumers and to purchasers. So we were founded in the year 2000. We're 16 now. And we were founded by purchasers responding to a report by the Institute of Medicine that said that upwards of 100,000 people were dying of avoidable medical errors in hospitals every year. And the purchasers who founded Leapfrog, some of whom are on displayed here, but there are many others, they were concerned not only that that number was simply shameful and horrible, but also because they didn't know it, that all the efforts purchasers had made to try and improve the quality of care their employees were getting and really get control of costs, all their efforts to study their claims data and really try to understand where things were going were for naught. They had no idea 100,000 people were dying from this thing that nobody had really talked about with them. So it was both the feeling of a horrible problem in healthcare and that they were blindsided, that really sparked the formation of Leapfrog. And the goal of Leapfrog, which is transparency, so give employees the kind of information about hospitals that we provide to the public about our own products, and value. Now, they didn't call it value at the time. That's become a new term. But what they meant was the same thing as what value means, which is the right price, the right quality. Both. They were going to use their purchasing to get the best possible care for their employees, and they were going to do it transparently, and everybody in the whole United States, not just their employees, but everybody, was going to have access to hospital information and performance data. They were almost laughed out of the room when they said they were going to do it in 2000. So it was considered just really out there. And now, 16 years later, it is, as I've shown, it is part of the American political momentum, really, in healthcare. So we function at the national level where we cross T's and dot I's. We have lots of science behind what we do. We're very careful about how everything is portrayed. Now, as I mentioned earlier, Dr. Barb Rudolph for many years led the development of the science behind the survey, making sure we had the right measures and the right evidence behind them, really created and really built an incredible survey. And that's what we do at the national level. And we also field the survey. We have it's a web-based survey. It's free to hospitals to complete. We compile the data. We check the data. We review the data. And all of that is done at the national level on behalf of our purchasers and members and everybody. But the great strength of Leapfrog, the heart and soul of Leapfrog, is right here in this room. And that is the regional level of effort. That's where employers at the regional level, through organizations like the Alliance, work with their hospitals in their communities to get them to complete the survey, and then to use that data in a whole variety of ways, either for value purchasing, benefits design, or simply public reporting and driving their employees to this information so they'll make the best decisions for their families. But that combination of regional use of the survey and regional activation of employers to get that survey publicly reported, and the national level where we take care of the science and the evidence base has been a very, very powerful combination and partnership. Leapfrog is now used by all national health plans and most public reporting sites, including WebMD, Consumer Reports, Castlight, a whole variety that you've heard of. The big names are all using some of our data because we collect it. So I showed you our logo in this mix of logos of public reporting sites, and we're proud to be among them. But what's different is we collect our own data too, and so the others can use that too. We have two initiatives. So the Leapfrog Hospital Survey is our voluntary initiative. It's a voluntary survey. It's free for hospitals to complete. They submit data to us on their quality and safety. Information unavailable elsewhere, we publish it by hospital. That's the survey. It's voluntary. The second initiative is the hospital safety score, which we've talked about today a couple times, that A, B, C, D, or F grade we give all hospitals, regardless of whether they report to us. And that's focused entirely on safety. So the survey is a really important tool for everyone in this room to be aware of, whether you're a purchaser or a hospital leader or a consumer, just really interested. The survey is a very special tool and a very special resource for all of us as Americans. We have, as I said, information available nowhere else. So we look at management practices that promote quality and safety. Does the hospital have a structure in place to stay safe and stay high quality? So even if they look high quality, if they don't have these practices in place, you can't trust that they're always going to be that way. That you can't trust they can sustain it. So those are things like, do they have the right electronics? Do they have the right prescribing system for their physicians that prevents medication errors, which That will lower medication errors by 40%, for example, if they have CPOE. Do they have hand hygiene policy? Do they have a variety of particularly known initiatives and known structures that can make a huge difference in the mortality rate of a hospital and in their ability to sustain excellence? Second, we have maternity care outcomes. Now, for obvious reasons, maternity care is not a major priority of CMS. CMS looks at populations over 65, and that is not their concern. This is a huge concern of purchasers. I've talked to purchasers where 50% of their spend is on overall health spend is maternity care, particularly when they have younger populations. That is a key component. So we look at C-section rates and early elective deliveries, episiotomy. We look at whatever measures we can get that have high integrity that will allow consumers and purchasers to compare among hospitals on how they're doing on maternity care. Big issue. We look at high-risk procedures, several different procedures where your death rate at one hospital can be 6 times higher than another, so you're very wise to go to Leapfrog and check that out. And we look at hospital-acquired condition prevalence. These are safety problems in hospitals. We've been looking at that for many years and continue to do so. And then medication safety is a big priority for Leapfrog. The information is not in claims. If it were available in claims data, you could go get it from claims data. You don't need Leapfrog. But you need standardized data on a very important issue like C-sections. You have to ask for it. You have to get it through Leapfrog in a very careful and controlled evidence-based way. So it's not in claims. It is using aligned endorsed measures. We are very careful about trying to use the best science behind the measures so it's fair. And we report by bricks and mortar, meaning we report by actual hospital. This is a bigger and bigger issue as hospitals consolidate into systems. Because CMS allows a hospital system, which might have, say, 10 hospitals, to report with one number or one set of numbers for the whole system. So all 10 hospitals apply to that number. Leapfrog will not allow that. You have to report 10 times to Leapfrog. Each hospital reports separately because that's how consumers see a hospital. No, we don't go to the emergency room at a corporation. We go to the emergency room at the hospital that's down the street from me. That's the consumer way, the consumer-focused way to report performance is by bricks and mortar. So Leapfrog is strongly committed to a bricks and mortar reporting, and we're really pushing on CMS now. They should be doing the same thing. And finally, our data is verified. Now, we verify it with an intensive desk review process. 2/3 of surveys end up back at the hospitals for additional documentation. And we've just this year started an on-site verification process. So there will be mandatory on-site verification of a random sample of hospitals this year. Hospitals report for a variety of reasons, and I've heard these are what they tell us, but it creates a culture of transparency and quality improvement to have Leapfrog reporting. They benchmark against their colleagues nationally on things they don't know about otherwise, and it proves. It's a way to really prove your transparency and commitment to quality. There's nothing more transparent than Leapfrog. And you are demonstrating to the public you serve that you are willing to earn their trust. Purchasers use it for public reporting across the country. They use it for they use it with transparency vendors through them, or they use it directly on their own website. And a lot are using it for value-based purchasing. In the state of Maine, they waive a $250 deductible for employees that use hospitals that meet their quality standards, which are Leapfrog standards, for example, is one example of how it's used in what might be considered a value-based purchasing arrangement of tying payment to performance. Now, nationally, we're seeing a huge increase in reporting voluntarily to the Leapfrog survey. As you can see, that curve is quite nice. We've gone up 43% since 2011. We're now at 1,750 reporting hospitals, which is actually 60% of the hospital beds in the U.S. Unfortunately, Wisconsin has not. You can see the curve for Wisconsin dropped dramatically right around the time we launched the safety score for some reason, but it's just gone way down, and we're seeing a little bit of improvement in the last few years, but this is not this is a distressing picture with a decline of 74%. And then other states, I know the Alliance is purchasing in. So Wisconsin, 9% of hospitals report, and the same in Iowa. And Illinois, much better, 49%. In fact, in Chicago, it's about 80%. But 49 is about the national average. We'd like to see better in Illinois. But clearly, there's work to be done in this area with voluntary reporting, and it's puzzling. But here's the thing. So if hospitals are not willing to voluntarily report to Leapfrog, then we have another answer, which is the hospital safety score. And we formed it in part because the feeling of our board was, well, if hospitals don't report, then what do? Do we just give up and say, well, we'll just only report those that are willing? No, because we don't see transparency should be voluntary when we're spending this much money on healthcare and so much at stake as consumers. We really should be insisting on this. And that's why we came up with the hospital safety score, letter grade, A, B, C, D, or F, all general hospitals. It's assigned regardless of whether a hospital reports to Leapfrog or not. If they don't report to Leapfrog, we don't use Leapfrog data, and it counts neither for or against them. If they do, we use the Leapfrog data, and it gives us a much richer picture and a more up-to-date picture than CMS can give us of that hospital's performance. But it is not a thumb on the scale, so it's an independent initiative. Here's a picture of the 30 measures we now use in the score. What's in green are the newest ones we just started using as of April, where two new infection measures, which we're very excited to have from CMS, are MRSA and C. diff. And then we also now have 5 measures of patient-reported experience, which are the HCAHPS measures. These 5 were picked by our expert panel, which is a Dream Team expert panel that advises us on the score. They picked these because the evidence correlates the outcome of these measures with safety. So everything on this score is safety focused, including these measures, because we do know that complication and infection rates in hospitals that do poorly on the 5 measures, communication with doctors, communication about meds, et cetera, are also poor. So there's good evidence, and that's why they're there. But you can take a look at these. Everything on the Leapfrog website and the Hospital Safety Score website is free, and we are very transparent, so you can really delve into it if you're interested. So we just put out the score, as I mentioned, back in April, and here's the state rankings. Again, this is all on the Hospital Safety Score website. Wisconsin went way up, so congratulations. You were 18 last round, but now you're 7. We think we don't know, we haven't done the analysis completely, but we think it might be because you do well on the HCAHPS measures. But in any case, clearly there's been some effort, and the Alliance, I'm sure, has a lot to do with a market improvement in, especially relative to the rest of the country, in safety. Then in Illinois, they went down in ranking to 15, and Iowa stayed about the same, fairly low. But even A hospitals, even the hospitals that get an A, have a lot of work to do. None of them are perfect, and in fact, here's a screenshot from University of Wisconsin hospitals and clinics. You can see just one screenshot of some of their data. Those first 3 data points, they are below the national average on 2 of them. So that is an example, just one, but you can look through. Most A hospitals are going to have data points, things to work on. None of them are perfect, and over time, Leapfrog will continue to raise the bar on what constitutes an A until we feel comfortable that A hospitals are safer. And then we also did an analysis by the Johns Hopkins School of Medicine, Matt Austin, who's also from University of Wisconsin. He did this analysis that estimates the number of avoidable deaths, and overall it's 206,000 plus. But here in Wisconsin, 2,300, in Illinois, 8,100, and in Iowa, 1,700, just in 1 year, number of avoidable deaths that we can attribute based on our data. There's lots of other ways, other kinds of problems that can happen in hospitals that we don't have data on, but of those, that's what's going on. So there's real impact here. So how do we navigate this change? Lots of changes, right? Transparency changes everything. Healthcare is not ready for it. Employers are really stepping up to the plate, really wanting to tie payment to performance, really wanting to drive this forward. So how are we going to navigate? Well, I have 3 principles, and I thought about them because I have a son who's learning to drive. He's 17, a little old for that, but and so I've had to think about driving. You know, when I drive, I don't really parse out what specific steps I take. You have to do that when you've got a 17-year-old, and it makes you nervous right away to think of him driving on his own. So what do I tell him in road conditions like this? Rainy, a little bit, a little bit confusing. How do you drive? How do you do it? And the first principle that I tell him, and that we all think of but maybe not even realize it, is transparent. You have to be visible to the road, and you have to be able to see out of your window, right? So turn your lights on. Not because you turn your lights on because so you can see, but so other drivers can see you. You got to do it. And you also have to get the defrost on. He didn't know what that was, so I had to tell him. But you put the defroster on. You got to see out the window. So transparency is two-way. You've got to have visibility. That's critical in driving, especially in conditions like this. So how does that apply to healthcare? Okay, we got another quiz. Which findings about a hospital upset consumers most in our market testing? And I will tell you it's consistent with others we've talked to. Was it A, high rate? We showed them high rate of dangerous objects left in after surgery. Was it B, don't know, hospital didn't report? Was it C, higher rate of mortality than other hospitals? Was it D, high infection rate at a hospital? Or was it E, all of the above? I would have said E, but I saw the market research, and it turns out it's don't know, by far. We were actually shocked in the research because consumers would say, geez, objects left in after surgery. Well, I talked to my doctor about that. That's a really big issue, yeah. But not when they saw don't know, they would go bananas. What do they have to hide? I'd be just so mad. I can't believe it. Very, very strong and consistent, very strong reactions from consumers. Now, you recall I showed you the screenshot from University of Wisconsin. I didn't mention those question marks, but you can believe it. You'll be seeing more of those. Those are the data that Wisconsin didn't report, and we make it very clear when they didn't report. Those are data that we get from the Leapfrog survey that they refuse to report. It will be increasingly a very strong ding on a hospital if they are shown to not be willing to disclose key information. So here's a screenshot now from, we do page reviews of hospitals as well as overall comparisons. Here's a hospital in your area that does very well in most things here. Here's what we did for University of Wisconsin. Look at that. They declined to respond to everything. There is a little button now on the left hand where consumers can write to the hospital. So hopefully we'll see more, and purchasers, you can do the same thing. Write to the hospital and say, where's your data? And we give you a little letter you can use. And again, others are reporting, but now others are starting to report those that declined to respond. And that's what Consumer Reports did this time. Just put out a big report on C-sections. They highlighted hospitals doing a lot of births that declined to respond to Leapfrog, and you can see University of Wisconsin's named on that list. So the second principle that I tell my son is practice. Got to practice. That's really number one way you're going to get better at driving. It just kind of starts to come natural. Well, that's the same with transparency. It turns out it doesn't come natural to us as human beings to be transparent. It's hard. And you can't assume that when all of a sudden CMS demands some data from you and is going to make it public, that you're just going to snap to it and be able to handle that well. So you have to practice. It also takes time to practice so you get good at quality. So Leapfrog has consistently been ahead of the curve, thanks to people like Barb Rudolph. Leapfrog hospitals have plenty of practice with getting good at the tougher measures that are out there and publicly reporting them, because we're way ahead of CMS, we're way ahead of almost every value-based purchasing initiative in reporting this. So by the time Leapfrog hospitals get in the game, they're ready. It's happening now. C-section rates, those will be publicly reported almost invariably within a couple of years. Hospitals doing Leapfrog are prepared. Barcoding, all kinds. Antibiotic stewardship is a big issue for CDC. This will be publicly reported, no doubt, in a few years. Hospitals that report to Leapfrog are used to it. They get that practice. That's so important. And the third principle is safety on the road, right? I want my kid to be safe. Well, safety applies in healthcare too. That should be the priority. When everything else is murky and difficult, it's difficult to get the pricing, difficult to figure out the quality, but the safety always comes first. If you stick to that, you will go in the right direction. And that's true for purchasers as well as hospitals themselves. Here's just one study that when consumers understand what's at stake with safety, so if you explain what safety is, if you say patient safety to an average consumer, they'll say, yeah, they should have a fire hose available. They don't know what that is. But if you say, we mean infections and errors, they'll say, oh yeah, that happened to my cousin, they have a story, and they really feel strongly about it. And they will pick the safer place regardless of cost. And they're right to do so. The numbers that were just out by a meta-analysis of some sort that was done on safety now suggests that as many as 250,000 people die every year from avoidable errors and accidents in hospitals, 250,000, which is, by chance, the population of Madison, beautiful Madison, Wisconsin. So this is a very serious problem, and consumers do have every reason to be focused on it. And safety always meets the value equation. It's always a good value. So I'm going to give you an example of that. There was a study in JAMA in 2013 asking how much extra do purchasers pay when there's a surgical site infection. And so Medicaid, it turns out, paid on average $900 extra every time there was a surgical site infection. And 5% of the surgeries had a surgical site infection. So $900 is a lot of groceries for someone on Medicaid, and it's a lot of money for something nobody wants. Medicare paid more. Medicare paid $3,000 every time there was a surgical site infection. So what about purchasers, what they called in the report commercially insured patients? $39,000 extra every time there was a surgical site infection. How many good jobs weren't created because these employers had to pay for a surgical site infection? Total waste, not value. Here's a calculator we have on our website. Purchasers can go in and figure out how much extra they're paying for medical errors. So here's an example of one purchaser, $20 million extra. So I've given you the landscape. I hope I've convinced you that transparency is critically important, that we all have to practice it, we have to get used to it, and we have to start paying for the results of care. It does have a huge impact when it's done well. And we have one really good example. Back in 2010, Leapfrog started reporting, the only one reporting on, by hospital, rate of early elective deliveries. These are deliveries scheduled without a medical reason between 37 and 39 weeks gestation. And they often result in babies in the NICU. They are very dangerous. They are not needed, and they are dangerous, and they're expensive. So you can see in 2010, 17% on average, that was the number we got. It was pretty high. And then you see what happened. Over time, thanks to the incredible amount of scrutiny and attention that our public reporting resulted in, we've seen a huge decline. Now, lots of folks got involved, so I don't want to say Leapfrog did this, but we galvanized it because people have been talking about early elective deliveries forever. Literally, ACOG has been saying it since 1970 that we shouldn't be doing these deliveries. So we know that wasn't making traction. What made the traction happen, what got everyone engaged and pushing, was that public reporting by hospital. And by the way, CMS got in the action, started doing it in 2013. So Leapfrog hospitals were ahead of that curve too. We're used to reporting it and had gotten that rate down, because you can get that rate down. So today it's 2.8%, which is just a remarkable achievement. And remember what that achievement means. It means hundreds of thousands of babies did not end up in the NICU in the United States, because of the work of people like you, part of the Leapfrog movement, part of this movement for transparency. So I thank you for being part of this, for inviting me here to Wisconsin today, and please keep at it. Thanks.